So excited to be here at the Cell Coast Conference, the first ever, and hopefully the first annual, here in Tampa, Florida, put on by Moffitt Cancer Center. My name is Fred Locke, and I am the chair in the Department of Blood and Marrow Transplant and Cellular Immunotherapy. And I have here with me today Natasha Kekre from the University of Ottawa in Canada, and I have Rizwan Romee from Dana-Farber Cancer Institute, and they're really both experts in cellular therapies. And tell me about what you're here to talk about at the Cell Coast Conference. Natasha.
So point-of-care manufacturing is something that a lot of academic groups are doing, and even early phase investigators are really looking at using point-of-care platforms in many different ways. I'm here to sort of highlight some of the global impact that has had and talk a little bit about how that can maybe also help us transform early phase data into clinical trials and ultimately market authorization for patients.
That's fantastic. So that point of care where we're making the cells to treat cancer patients at the center itself. And I think that we're going to see more and more research around that. And it's amazing that in Canada, you have the regulatory framework to allow that. And I think we have a little more work to do in the US. We're a little behind in that aspect. So we really appreciate your insights into that.
Yeah, I'm excited to be here.
Yeah. Okay, so Dr. Romee, tell us about what you're here to teach us about with cell therapy.
No, I'm super excited to be here. What a great group. I think two things. I want to talk about the approaches we are pursuing in the NK cell field to make them persist and be more effective in animal models and hopefully take that to clinic. And the approach there we are taking is knocking in IL-12, a fusion cytokine, where IL-1 also has this collagen binding domain for enhanced safety. And then also talk about this new idea, which is not really new, but the new version of, modern version of this idea, where we can genetically modify non-pathogenic E. coli from our gut and actually target different types of cancer, which is showing very promising data in mouse models.
So what I'm hearing is the future cures to cancer are right here within this man's brain. And what he's telling us is that engineered NK cells really hold promise for treating cancer patients, and we can actually harness bacteria to treat cancers. So we really appreciate you guys coming here for the first Cell Coast Conference, and looking forward to having you guys back again next year and beyond. Thank you so much.